Introduction to Cushing's disease. Have you ever wondered why your horse's coat has suddenly grown longer, or why it seems to be losing weight despite a healthy diet? These could be signs of a common endocrine disorder in horses known as Cushing's disease, or pituitary pars intermedia dysfunction, PPID. Today, we're delving into the causes, symptoms, and diagnosis of this disease, so keep listening to learn more about this condition and how to manage it. Causes and symptoms of Cushing's disease. Cushing's disease primarily affects the pituitary gland, which is a small pea-sized organ at the base of the brain. It's responsible for producing hormones that control various functions in the body. In horses with Cushing's disease, there's a loss of inhibition of the pituitary gland, leading to an overproduction of these hormones. This overproduction is mainly due to an enlargement of the pituitary gland, which happens as a result of a lack of dopamine control. So, what symptoms should you look out for? The signs of Cushing's disease can be quite diverse, but some of the most common ones include a longer and thicker coat that doesn't shed properly, weight loss, and abnormal fat redistribution. Other signs may include excessive drinking and urinating, lethargy, and recurrent infections. It's also worth noting that the disease primarily affects older horses, with ponies being more susceptible. Diagnosis of Cushing's disease. But how is this disease diagnosed? Diagnosis of Cushing's disease in horses is based on the history, clinical signs, and specific hormone tests. These tests include assessing cortisol and adrenocorticotropic hormone, ACTH levels, which are typically elevated in horses with this condition. Management of Cushing's disease. Now that we've covered the causes and symptoms, let's discuss the management of Cushing's disease. While there's no cure for the disease, it can be managed effectively with the right approach. One of the mainstays of treatment is medication, with the prescription-only medicine Presend being the most commonly used. This drug helps to control the hormone levels in the body, reducing the symptoms of the disease. Aside from medication, supportive care is also crucial in managing Cushing's disease. This may include regular grooming to manage the long coat, dietary modifications to maintain a healthy weight, and regular checkups to monitor the horse's condition. It's also important to be vigilant for any signs of laminitis, a painful condition of the hooves that is often associated with Cushing's disease. Conclusion of Cushing's disease. In conclusion, Cushing's disease in horses is a common endocrine disorder caused by an overproduction of hormones due to an enlarged pituitary gland. The disease presents with various symptoms such as a longer coat, weight loss, and excessive drinking and urinating. While there's no cure, it can be managed effectively with medication and supportive care. Remember, early recognition and diagnosis are key to implementing successful management strategies. So if you notice any of the symptoms we've discussed, don't hesitate to contact a veterinarian. Your horse's health is always worth the effort to help them to be more comfortable. Thank you for watching.